Hello everyone and welcome back to MediInsights. Today we're exploring Avapritinib, a targeted cancer therapy that treats specific gastrointestinal stromal tumors and certain mast cell diseases. In the next minute you'll learn what it's for, how it works, dosing essentials, common side effects, and critical safety advice, so stay with us. Starting with use of Avapritinib Tablet. Avapritinib is approved to treat adults with unresectable or metastatic gastrointestinal stromal tumor that harbors a PDGFRA exon 18 mutation, including the D842V mutation. Avapritinib is also approved for advanced systemic mastocytosis, and lower-dose regimens are approved for some forms of indolent systemic mastocytosis. Next, dosage of Avapritinib Tablet. For GIST with PDGFRA exon 18 mutations, the recommended adult dose is 300 mg taken orally once daily, and you continue until disease progression or unacceptable toxicity. For advanced systemic mastocytosis, the usual recommended dose is 200 mg once daily. For indolent systemic mastocytosis, lower doses, such as 25 mg once daily, are used. Take Avapritinib on an empty stomach at least 1 hour before or 2 hours after a meal, and follow your prescriber's instructions about dose adjustments. Next, mechanism of action of Avapritinib Tablet. Avapritinib is a selective type I tyrosine kinase inhibitor that binds and inhibits activation loop mutants of KIT and PDGFRA, blocking aberrant kinase signaling that drives tumor and mast cell proliferation. This selectivity explains its potency against PDGFRA D842V, mutant GIST, and activity against certain KIT-driven diseases. Next, side effects of Avapritinib Tablet. Common adverse reactions you may experience include peripheral and periorbital edema, nausea, vomiting, diarrhea, fatigue, and changes in appetite. Cognitive effects such as memory problems, confusion, sleepiness, mood changes, and hallucinations have been reported and may be severe. Serious but less common events include thrombocytopenia, anemia, and intracranial hemorrhage, so new neurologic symptoms or severe headaches require urgent evaluation. Photosensitivity and fetal harm are additional important risks. Next, important advices for using Avapritinib Tablet. Before you start, ensure testing confirms the appropriate mutation and discuss pregnancy avoidance because Avapritinib can harm a fetus. Your healthcare team will check blood counts and liver function and monitor for cognitive changes and bleeding risk. Platelet checks are especially important in some patients. Avoid strong or moderate CYP3A inhibitors or expect dose changes if such drugs are necessary, and report any new confusion, severe dizziness, or sudden severe headache immediately. Follow dose modification guidance from your prescriber if side effects occur. Thanks for watching. If this helped, please subscribe to MediInsights and leave a question or comment below so we can cover it next. Stay informed, ask your healthcare team before making changes, and take care until our next video, everyone.